Hi, my name is Dr. Treyzon, and I am a gastroenterologist in Los Angeles. And this video, which should take just a few minutes, is an attempt to describe the services that we provide and the nature of how we provide those services. I'd like to tell you first about the 7 basic things that we do for people, broad categories. And then I want to move into why I think that we are good at those things and perhaps what separates us from other providers. The first, in terms of what we do, is we solve digestive problems. For example, if you have gastrointestinal bleeding, abdominal pain, diarrhea, bloating, and you're suffering and you need help, we are good at stopping those symptoms and helping you feel better. So we solve problems. That's problem number 1. Problem number 2 is we investigate problems that are not disruptive. For example, you have a new symptom, whether it's flatulence, difficulty swallowing food, distension, weight loss, weight gain. You're not really bothered by it, but you're concerned that it might be a sign of something more ominous to come and you want to look into it or understand it better. So we investigate problems that are not highly disruptive. Number 3 is we screen for problems, meaning you don't have a problem, you don't anticipate a problem coming, but you know that there are certain things that through random bad luck could happen to you. For example, we screen for colon cancer and colon polyps in everyone ages 45, 50 or above. And that's a big part of what we do is preventive health. A 4th reason is you don't have a problem, but someone else in your life does have a problem and they want you to do something about it. An example of which is, for example, if you have bad breath, you're not bothered by it, but your wife is. Or if your doctor is worried about a blood test and you don't seem to think it's a big issue, but your doctor does and they've referred you for further evaluation. Those are examples of other people's problems as they relate to you, and that's why you're here. Okay. Another reason why people see us is they feel guilty about something with regards to their digestive system. An example of that is if you have a history of disordered eating and you did bad things to your body and you want to now check out if there's damage. Or perhaps you've been eating a gluttonous kind of diet all your life and you wonder if there's something that's wrong. Or perhaps you've done drugs a lot and you wonder if there's damage to your liver or your stomach or something like that. So you have guilt and you want to investigate it. Or another reason why people come see us is they don't have a digestive problem that they're aware of, but they've been diagnosed with a new problem with regards to another system in their body that might have gastrointestinal ramifications. Examples of that would be is if you've been diagnosed with amyloidosis and you need a biopsy of your gut. Or if you have scleroderma and your doctor wants to check if you have ulcers in your esophagus or dysmotility. Or perhaps you have endometriosis, chronic pelvic pain, and your doctor wants to understand if you have small intestinal bacterial overgrowth as well. So associations with other diseases, basically. Lastly, another reason why people would see us is if they have an established gastrointestinal disease, such as Crohn's disease, colitis, and they just want optimal management. Or maybe you've been diagnosed with a cancer and you'd like to have it optimally managed by us. Alternatively, perhaps you've been treated extremely well with another doctor, but you've had to move and relocate to Los Angeles and you'd like us to help take over care. Or perhaps you've lost your insurance with another doctor and you need us to help out and step in. Something like that. So those are the 7 main reasons why someone would seek out someone like myself in our practice. And then reasons why they would decide that we're perhaps better or not better for the kind of relationship they would like to have include the following things. And this is what I think really separates us from other practices. Number one is experience. I've been doing this for a long time. It's my 15th year. It's July 2020 now. And the things that I have learned over those 15 years have helped me to acquire my specific knowledge in solving problems as they relate to your potential needs. The things that I knew when I started are different than what I know now, and only with time did I realize that. I'm better now than I was 15 years ago. I have fought it through a lot. Things that I thought were true 15 years ago or 10 years ago, through time I have realized might not have been the whole story. And we have evaluated the same problems now in different ways. And it takes time to learn those things. And only with time did I get this good at doing what I do. Number two, I don't think it's just a function of time, because I could have done the same thing over and over again for the last 15 years and I would have really not been better at it just because I had 10,000 chances at it. But it's the number of different iterations that I've had at this, meaning one thing wasn't working, I tried a different approach. Sometimes I thought I knew everything about something, but I just wanted to try it a different way, and we had great success or great failure. So it wasn't just the number of hours that we've put into this, it's mostly the number of changes, pivots, iterations that have gotten us to where we've acquired this skill set. Number three is that we think that you know yourself better than we know you. You've been dealing with yourself for many, many years, and we're just dealing with you now. How can it be that we know everything about you? We don't. You know better. Sometimes that's not the case, but the majority of the time, you really do know what is best for you. And so we don't try to push our agenda on you. We ask you, what do you think? What do you think's going on? What are the concerns? What are the issues? If you were the doctor, what tests would you order? What treatments would you do? How do you think we need to solve this? Oftentimes, patients don't know that answer and they seek my guidance on that, and that is what I provide. But I can't believe how many times I have learned exactly what the problem is or the magnitude of the problem based on simple, inquisitive interviewing like that. The other thing that sets us apart is our adaptation to what your pace of inquiry is. What I mean by that is some people want to go slow, some people want to go fast. Some people say, this is a terrible problem, I gotta find out the answer today or this week, and whatever needs to be done, let's get on it. Alternatively, some people are cautious, they have reasons to be cautious, and they wanna go one step at a time, acquire knowledge, move to the next step. So we do whatever is at your pace, whatever it is that you wanna do. My general approach is that we have two simultaneous pathways of solving your problem. Pathway number one is a diagnostic pathway where we run tests, whether it's blood, stool, breath, imaging, colonoscopy, endoscopy, wireless pill camera, whatever, okay, diagnostic. And then the second pathway is a therapeutic pathway. And we typically do both at the same time. And the reason we do that is because why wait to get well? There's a chance that one of the therapies that we try might be that best therapy that just solves your problem right away. Furthermore, by solving your problem or helping you feel better, we learn what the problem might have been. For example, if we gave you an antibiotic and you get better, it might have something to do with bacteria. If we gave you an anti-acid and you feel better, it might have something to do with acid. And these kind of things help limit our search and solve your problem faster. So it is this simultaneous pursuit of diagnostic and therapeutic and the number of iterations within each thing that makes us really good. Lastly, we consider your limitations. And what I mean by that is not everyone wants to pursue their treatment and diagnostic pathways at the same rate or with the same vigor. And what I mean by that is some people are limited by time, just too busy. Some people are limited by energy. Like, it's not such a big problem for you. Maybe your wife is hounding you to get stuff done, or your husband is, and you want to go at whatever pace lets you get everything in your life taken care of by the priority that you think is most important. Maybe you want to go in a very cost-effective strategy. Maybe that's your number one priority. That is no problem, and we respect that. It's as important a factor as anything else. And lastly, some people are just scared of doing this, whether it's scared of not getting an answer, or they're scared that they will get an answer and the answer is bad, or maybe everything that they thought about their condition was not as bad as they thought and that's a little embarrassing for them. Whatever the reason, we'll work around your limitations to help solve your problems. The only reason we are here is to fulfill the needs that you have. You are the customer, you are the patient, and we are at your will. That's an introduction to what we do. If it jives with your take on this situation, we encourage you to visit us, whether it's through an office visit, whether it's through a televideo visit, a phone call, whatever. Reach out to us, we'd love to help. You could learn more about what we do at www.treyzonmed.com. Thank you.